Attention, Washington, D.C. A new public health threat has emerged. Stay tuned to learn about the recent measles case and how it could affect you. The bustling metropolis of Washington, D.C. faces a new public health concern, a confirmed case of measles. This highly contagious disease, once considered nearly eradicated in the United States, has reappeared, carried by a traveler from Minnesota. The infected individual arrived in the city several days ago, unaware they were carrying the measles virus. Health officials are now working tirelessly to contain the potential spread and are urging residents to be vigilant. The measles virus is highly transmissible, spreading through the air via coughs and sneezes. It can linger in the air and on surfaces for up to 2 hours, making even brief contact with an infected person a risk. The virus can also spread before the characteristic rash appears, making early detection challenging. This recent case highlights the critical importance of vaccination and community awareness in preventing outbreaks. The measles virus can infect anyone, regardless of age, vaccination status, or overall health. However, unvaccinated individuals, infants too young to be vaccinated, and those with weakened immune systems are particularly vulnerable. Measles can lead to serious complications, including pneumonia, encephalitis, and even death. Therefore, it is crucial to understand the risks and take appropriate precautions. Upon arrival in Washington, D.C., the infected individual traveled by Amtrak train on March 19th. This journey took them through Union Station, a bustling transportation hub with thousands of daily commuters. The individual spent time in the station's concourse, potentially exposing numerous individuals to the virus. Days later, experiencing symptoms, the individual visited an urgent care facility in the Adams-Morgan neighborhood. While seeking medical attention, they unknowingly exposed healthcare workers and fellow patients to the measles virus. Health officials are particularly concerned about potential exposures at this location, as healthcare settings can facilitate rapid disease transmission. The infected individual's travel history and activities have raised concerns about potential community spread. Measles is highly contagious, and exposure can occur through even fleeting contact with an infected person. Anyone who visited Union Station on March 19th or the urgent care facility in Adams-Morgan in recent days should be aware of the potential risk and monitor themselves for symptoms. The measles virus poses a significant risk to public health, particularly in densely populated areas like Washington, D.C. The virus spreads easily and can quickly infect large numbers of people, especially those who are unvaccinated or have weakened immune systems. Therefore, it's essential to understand the risks and take steps to protect yourself and your community. Vaccination is the most effective way to prevent measles. The measles, mumps, and rubella vaccine is safe and highly effective, providing lifelong immunity in most cases. 2 doses of the MMR vaccine are recommended for children, the first at 12 to 15 months of age and the second at 4 to 6 years of age. Adults who are unsure of their vaccination status should consult with their healthcare provider. They may recommend a blood test to check for measles immunity or advise receiving a booster dose of the MMR vaccine. Additionally, individuals who believe they may have been exposed to measles should contact their healthcare provider immediately, especially if they experience symptoms such as fever, cough, runny nose, red eyes, or a rash. Protect yourself and your loved ones by getting vaccinated. For more information, consult your healthcare provider today. In the face of this recent measles case, it's crucial to remember that protecting public health is a shared responsibility. We must all take steps to protect ourselves and our communities from this highly contagious and potentially dangerous disease. Vaccination is our first and most effective line of defense. If you haven't already, schedule an appointment for yourself or your child to receive the MMR vaccine. If you're unsure about your vaccination status, consult your healthcare provider. Early detection and isolation of cases are also essential in preventing the spread of measles. If you experience any symptoms of measles, seek medical attention immediately. Stay informed about health advisories and outbreaks in your area. Knowledge is power, and staying informed empowers us to make responsible decisions regarding our health and the health of our communities. By working together, we can prevent the spread of measles and protect the most vulnerable among us.